In this video, I'll show you why, as a senior, you need to be doing these 5 simple tests every month forever. There are a lot of videos on YouTube about types of exercises seniors can do to improve their physical health, but how do you know where you stack up against healthy seniors? These 5 simple tests will help you better understand the important things to track as you age. In this video, I'll take you through a 15-minute simple functional testing routine that will help give you a good idea of where you're at functionally and which categories you may need to focus your attention on improving. My name's Justin Stiver, Doctor of Physical Therapy and founder of The Active Adult. I own a physical therapy practice with 7 locations in Southwest Florida. There's a reason that for all of our patients on their first day and about every 30 days after that, we do a variety of functional tests. This helps us understand how to best tailor the proper exercises to their current levels of flexibility, strength, and function. In business, there's a saying, what gets measured gets managed. The reality is that we all need to be treating our bodies a little bit more like a business and managing our physical health better. It's also important to establish a good baseline for each of these tests. The tests we'll do today are going to help you measure your general leg strength, power, balance, and the mobility of both your upper and lower body. These are all key factors that predict your quality of life and longevity. You'll want to write your scores down somewhere so you'll be able to reference them each time you retest yourself, which should be about once a month. This will help you track your progress and make sure you're making good improvements, or in some cases, make sure you're not actually losing function or strength as you age. We put together a PDF that can be downloaded for free using the link in the description on this video. The PDF shows you what the normative scores are based on your age group, and it contains a tracking sheet that allows you to keep track of your progress every month for a year. The first test I want to show you is called the Timed Up and Go test, also called the TUG Test. This is a widely accepted test for seniors to predict mobility and your risk of falls. So you're going to have a chair, and you're going to have a cone or some kind of object 10 feet away from the front of the chair. And the starting position is sitting down in the chair, not leaning back against the back of the chair, but just having a good upright posture. The right way to do this is without using your hands. But if you're not able to do that without pushing off from your hands, then it's okay to use your hands. You just want to make the note that you had to use your hands. So the clock's going to start. You can either time it yourself with a stopwatch in your hand or have someone else. It's going to start when you first make your first move to stand up from the chair. You're going to walk 10 feet around the cone. Doesn't matter what side, whichever side you're more comfortable with, feels more natural. And then come back to the chair and sit back down. The clock will start when you make your first move and stop when your rear end hits the chair sitting back down. It's important to note that this is not a race. You should actually be doing this at your normal, confident walking pace. And racing or hurrying is not normal. So go at your normal pace, okay? We're gonna start now. I'm gonna walk around the cone at my normal pace, and I'm gonna walk back to the chair and sit down. With some fancy editing, we're going to put my score right here. But I want to go ahead and give you some benchmark scores, kind of by your age. So if you fall between the age of 60 and 69, then the average score for this is 8 seconds or less. If you are 70 to 79, then it's 9 seconds or less. 80 to 89, 11 seconds or less. And anything over a 13.4 second, that means that you're at a high risk of falling, and you definitely need to work on your balance and your strength. Next up, let's talk about the 5-time sit-to-stand test. It's pretty much exactly like the name implies. You're going to stand up and sit down 5 times as fast as you can while keeping good control and good technique. So you're going to have a chair with a back to it, but you're not going to sit back to the back. You want to sit up nice and tall as if there was no back to the chair. It's okay to do a practice stand just to make sure that you're set up right, and you want to try and do it with no arms. Just like the TUG test, if you need to use your arms, that's okay if that's the only way you can do it. But you want to write down whether you use your hands or not, and sometimes maybe it's after 2 or 3 repetitions as your legs start to tire that you need to use your hands. So if that happens, just write down after 3 reps you used your hands. So you're going to have a timer in your hand or have someone timing you, and the clock's going to start when you make your first movement, and it's going to stop when your rear end hits the chair after your 5th repetition. It's important that when you stand up, you bring your legs all the way straight. A lot of people will want to cheat and get like this and sit back down, and you're not really doing it correctly. You want to stand up all the way, lock your knees, stand up tall, and then sit back down. So we're going to do it now 5 times as fast as we can. Go. And with some magic editing, we're going to put my score up there. And I want to give you some normative values based on your age. So if you're between the age of 50 and 59, then the average would be about 10.3 seconds. 60 to 69, 14.5 seconds. 70 to 79, 15 seconds. And 80 or older, you want to be around 20.2 seconds. Now, it has also been found that patients who score greater than 17 seconds on this test have been found to have a 30% higher risk of hospitalization. So you want to keep that in mind too. Next test is called the Apley scratch test. And it's kind of a funny name, but what it's testing is your shoulder mobility. So I'm going to show you facing forward, and then I'll show you facing backwards. But you're going to take one hand and you're going to go up and then down the back. The other hand, you're going to go behind and up the back. And you're going to try and bring your thumb of your bottom hand towards the middle finger of the top hand. And you're going to see how close you can get. Okay? And by the way, you'll want to test the other side. And what you'll see here is that when I go the other side, I'm not going to score nearly as good. So I'm going to be further off that way. So maybe I can't see behind my back, but I'm guessing I was a couple inches apart on the first test, and I was more than 4 inches apart on the second test. So the way that we kind of scale it, there's some conflicting opinions here, but if you can touch your fingers together, then your mobility is considered excellent. If your fingers are almost touching, so say from like 0 to 2 inches apart, then it's good. If your fingers are from 2 to 4 inches apart, it's fair. And if your fingers are more than 4 inches apart, then you got a lot to work on. I obviously have a lot to work on. Now, it brings me to a good point that I wanted to talk to you guys about. Just because these are the average scores doesn't mean that you don't have a special medical history that can justify or dictate how you're going to do on these tests. It might not be a level playing field. So maybe on some of the mobility tests for your legs, you've had a joint replacement like a hip replacement or a knee replacement. Maybe you've had an injury like I did playing baseball professionally. I ended my career as a pitcher with an arm injury. So that's one of the reasons why I don't have great shoulder mobility. So if you've had a rotator cuff tear or a fractured arm at some point in your life, I wouldn't be surprised if you wouldn't do as good on this test. Now, it doesn't mean you should just throw it out the window and it doesn't apply to you, because it does. You want to take your baseline measurement and then you want to retest that every month, because you will be able to improve some. I know I would be able to improve. If I did this regularly like I should, I would improve. But what I'm really looking for is that I don't regress. I don't continue getting further apart as I age. So take that baseline measurement so you have a good comparison as time goes on. Next up is a mobility test for your hips and your legs. I call this the Z sitting test. Now, this isn't a formalized test. So I don't have any normal data or normative values, but the key is you want to get into the Z sitting position. So one leg is in external rotation, kind of laying as flat as you can, and the other leg is an internal rotation. And then you want to see if you can just hold your balance up there. Now, I'm a little tight and I'm getting pulled some to the side, so it would feel more comfortable for me to put my hand out and just kind of rest. And if I try and sit up straight, I feel a little bit bigger stretch and I feel off balance. So the answer is kind of like rate yourself on how hard it is to sit this way on a scale from 0 to 10. So for me, I would say it's probably a 4 out of 10. And that's a subjective number. But it's because you're doing it the same every time that it's going to be pretty accurate. So now if I'm tight here, then what happens is the test becomes the exercise. So if I want to improve this, I'm just going to spend a few minutes every other day or so doing this stretch and kind of pushing myself up into being tall. Then you want to go ahead and switch legs. You can see, because not everyone's the same on both sides. In fact, usually the leg that you want to put out first is going to be the better side usually. So me, I'm probably even a little bit tighter here. So I'm about the same actually. So I would also rate this about a 4 out of 10. So I'm going to write that down and I'm going to retest every month. And because this is something that I struggle with a little bit, I would definitely want to practice this from time to time. The last of the 5 tests is called the single leg standing test. Sounds exactly like its name. You're just going to see how long you can stand on one foot. I put a chair here next to me. I would feel comfortable doing it without a chair, but if you feel like you lack some confidence in your balance, then I would recommend putting a chair. And usually you want to put it on the side of which side you lift your leg. But if you feel really uncomfortable, you can do it on both sides, or you can stand in a door frame to where you have that door frame on either side. That's fine too, okay? But you're just gonna lift your leg up and hold your balance. So you might feel a little wobbly, and it's okay. And it's okay to move a little bit as long as you can correct your balance and hold it without having to reach out and touch anything or put your foot down. So while I'm doing this, I'm gonna give you some normative values. If you're less than 50 years old, you should be able to hold this for around 45 seconds or more actually. Between 50 and 60 years old, you want to be able to hold it for more than 27 seconds. 60 to 70, the average would be greater than 24 seconds. And 70 to 80, about 18 seconds or more. If you're over the age of 80, then a good number to shoot for is 9 seconds. And it's been shown that people that can't do this for more than 5 seconds have a significantly higher risk of falling. So if you fall below that 5 seconds, you definitely want to work. But you can also use these normative values to try and get yourself up to that baseline average. Now that you've identified your strengths and weaknesses, check out this video on our channel, which will help you improve those scores. Until next time.